And we're gonna do a simple coping for a metal ceramic crown, full coverage of ceramic, so fully aesthetic. Now, the first thing, we mark the margin. As we know, we always do this. And once we've done that, we harden the plaster. So this leaves no, this has no thickness. It's 0 microns. It only covers the porosities on the surface of the plaster and makes it harder. We won't be able to scratch it as easily. That's the idea. When we remove some wax, excess wax, or adapt it to the margin. So now we add some wax. We do the foiling with some wax. A wax that is that melts at a higher temperature than the regular wax, so as to stay like this even when we work the regular wax upon it. Obviously, there's going to be the spacer placed and isolating liquid, but here we create the space for the difficult parts of the abutment where the crown should fit, and we create an extra space for this easy fitting. This is very important to notice. And what we do here in wax, we can do digitally on the computer when we design the inside of a crown in the CAD, computer assisted design process. So now we apply the spacer. So everything that is done here, we can do it in the same way digitally. That's the idea. So this is the spacer. Yeah, it was the isolating of the spacer. That's the spacer. That's the right thing to use now, yes. And as we know, the spacer is placed away from the margin where the crown should perfectly close on the preparation, on the margin of the, that's why the margin of the preparation has to be very clearly prepared, so to say, and clearly reproduced in the impression and in the plaster model. Yeah, because that's where we will have the nice closure and avoiding food and other things to come there and to get into and to stick there and to damage the abutment in time. So now, once it has been isolated, spaced and isolated, so after the spacer we put the isolating liquid, yeah, in order to allow the wax to come out, the wax pattern to come out. We want to invest, obviously, the wax pattern to turn it into metal by casting. So now we dip it in melted wax. That's a dipping process. Waxes melt there some 85 degrees. It's a special wax there that melts quite quickly. 85 degrees is not too much. So we do it starting with a corner, introduce it quickly, and then slowly, like taking with a spoon, we take it out. So take it out slowly. There you go. So that wax pattern coping has to be uniform. And by the transparency of it, we can see exactly where I have to cut it. But before doing this, we will apply some cervical wax. Because if we do it without this wax, the elasticity of this first wax the yellow one, will modify the shape at the margin. So now we can take out the excess, remove it again with a warm spatula because we don't want to stretch the wax in any way. You see that the margin of the abutment was ditched in such a way so as to allow easy removal of excess wax in this stage. We also take away every wax from the rest of the abutment because we want to have a perfect fit of this into the model, into the socket in the model. So now we know that this is a simple coping because it will cover everything with ceramic. So we don't want to make it bigger. We want to leave enough space for the ceramic, so most of the space will have to be for the ceramic, except for the cases when the ceramic will stay like 5 millimeters away from the metal. That's not good. You should have like 3 millimeters. But with a normal abutment like this, there's not much left to do. Yeah, just have to be round and to follow somehow from a distance the shape, the final shape of the tooth. And the final shape of the tooth will obviously be in ceramic. So now you try to mimic the margin, the incisal margin of the tooth there, but again from a distance. This central is a little bit tilted in the original. So that's why there the technician noticed that, and she's free to add, she feels free to add a little bit more because she knows that it will be, you see, the incisal. She realizes that how much she will be able to apply in ceramic afterwards. Now she can tell that yes, it's a fair distance from the incisal margin. She's afraid and she wants to leave only 1 millimeter there. Yeah, some ceramics are less resistant than others. The problem is that if you do much metal there, then the translucency will decrease in the final crown. The distal and mesial also somewhat following the future shape of the crown, but again from a distance. Some technicians, they also do some relief on the labial surface just in order to help when they place the ceramic, to avoid placing too much opacious dentin on the surface. But this is kind of complicated. What I'm saying is that at times this simple coping is adapted and has a little bit more wax placed in certain points just to increase the final aspect of the crown. But this is high level design. What we see here is the simple and regular way of doing it. Everything has to be round. We don't need sharp edges that will eventually break the ceramic while the patient is using it and chewing. Yes, so round shapes. You can ask, okay, why don't we do this in metal? Because we want to do it now. It's way easier to do it in wax and not to touch it in metal anymore. Besides, when you trim from the metal, you can have powders, and you know that you breathe in your lungs, and you don't want that to happen. So the coping should be not thinner than 0.3. It depends, of course, what metal we use, but this has been somewhat ensured by the first dipping of wax. That is for sure like 0.3. So whatever we add now is more than that. So we're on the safe side. See here in this case, some technicians, they mimic the mamelons and other things. So, but it also depends on the aspect of the neighboring teeth and the picture that the technician receives from the dental office. And now the technician is checking if there is enough space for the ceramic, because she wants to place ceramic on the palatal aspect of the tooth. So she has to check whether there is enough space remaining for the ceramic, and in occlusion, the incisal edge, if there is enough space for the ceramic on the incisal edge, she feels like she needs to trim a little bit more from the metal at that margin. Again, she could do that in metal, but it's more difficult, and why do it in metal while you can do it in wax? So it depends it depends, all that we do here is depends on the difference between the abutment, actually the die on the model. Yeah, the abutment is called in the mouth, and the same thing on the model is called the die. So the distance between the die, the abutment, and the shape of the final crown, that decides how much metal you place here. At the end, we have to clean very carefully at the margin. And now, yes, the wax is dried. I mean, it's cool. So now, carefully, we can do it without having a spatula that is warm. Everything sits on place. It's cool, and you can just trim it like this, slowly, to get to that margin. And here, it's important to have the plaster hardened, to have had the plaster hardened in the very beginning, because now you don't scratch it, you don't modify it. It will stay like this. Of course, this doesn't mean that you can do whatever you want, but anyhow, it's safer if it has been hardened previously. Let's see if it comes out. Yes, it does. So that's how we do it.